Welcome to Athletico's Golf Information Session. I'm Tony McCormick. I've been a certified athletic trainer for 37 years, the last 20 years at Athletico. I've worked with high school, collegiate, and professional athletes, and currently work at Fenwick High School as their athletic trainer.
And my name is Joe Estes. I'm a physical therapist at Athletico in Oak Brook, where we have our golf performance center. I've been here for about 7 years now, and I've been overseeing golf performance and golf programs for about 5.5 years. I've worked with golfers all skill levels, from juniors to weekend hacks to semi-professional to professional golfers, getting back onto the course from injury, rehabbing them from surgery, dealing with general aches and pains that keep them from playing golf. And we're excited to be here today to talk to you about golf injuries and common ailments that we see in the golf swing.
Joe, what are some of the most common injuries you would see with a recreational golfer?
So recreational golfers, the biggest thing we're going to see usually is overuse problems, and that's because people are getting out and just playing more than what their bodies are really capable of doing, and over the course of, say, a 7-8 month golf season, with maybe not ideal conditioning outside of golf and work, we get a lot of overuse injuries from the soft tissue, so things like muscle strains, disc issues in the spine. We see a lot of rotator cuff type tendinopathies, so rotator cuff tendonitis, and anything down the chain into the knee or the ankle, just based on how the person might be swinging. And so a lot of times what I see is that the most commonly injured area is going to be the lower back. By far and away, that's the most common thing that I deal with golfers here, is lower back pain.
One of the things I'm sure we've all heard is the golfer's elbow. Is that something you see a lot of, and is that preventable?
Yeah, so golfer's elbow, and we do see a lot of elbow and wrist issues as well. I think the wrist problems that people will get will be more from trauma. Say they come down on a ball and there's a root underneath the grass that they don't see, and they come down and take a divot, their hand hits the root, and then that causes a lot of wrist pain or a sprain of a ligament. In regards to golfer's elbow, or even tennis elbow, that's the funny thing about golf, is we actually get just as much tennis elbow on the outside of the elbow as we do golfer's elbow on the inside of the elbow. That's an ailment that a lot of people will get, especially that sit at desks all day, where they're doing a lot of typing for hours and hours and hours and using a lot of the muscles in their forearm. But a lot of times it's actually a swing fault that we'll see when we analyze someone's golf swing, where we'll see some changes in the swing that place increased stress to the inside of the elbow or the outside of the elbow, depending on which arm we're talking about. So we will see a lot of elbow things as well.
Do those choke pad straps they wear on the elbow, or like the back braces, help at all, or just more for show?
Yeah, I think that in terms of bracing, I think that wearing a back brace while you play golf should really be a last resort. If your back bothers you to the point where you need to wear a back brace to play golf, then you need to get some medical help and try and figure out the bigger issue of why you're having so many back problems while you're playing. In respects to the elbow, wearing something like a counterforce strap that you'll see tennis players or golfers wear around the top of the forearm there, that can be a really effective tool to help unload an ailing tendon if you do have elbow pain while you're playing. So that would be something that I would say is fair enough to use when you're kind of getting back into golf after an elbow problem, or if you just have some really low grade elbow pain. That's probably a brace that I would say is okay to get to play with.
Is it too early to go back after certain injuries that a golfer would have, i.e. back or knee surgery or shoulder issues? Is there a recommended time frame, kind of like a baseball pitcher will go out and throw long distance and move in? Would you recommend the same thing to your recreational golfers as a return to golf?
Yeah, that's a good question, and part of the answer to that is going to be what they're returning from. So if it's a surgery, then obviously you have to ask the physician, the surgeon that you had perform your surgery, when you're able to go back to play, because tissue healing time is different for each surgery if it's a surgical case. If we're not talking surgical and we're just talking about aches and pains, usually my education of my golfers is going to be more dependent on how they feel while they're playing. If it's one of those people that have to take a handful of ibuprofen or something before they go play, and then they have to take more when they're done and ice it when they're done, you may want to try and get some medical care and try and see or work with an instructor, look at your swing mechanics, see if there's something you can do differently in your swing where you're not relying on medication and ice to get through one round of golf. Part of it can be decreasing the frequency of how often you play, which no golfer wants to hear. I want you to play less. They want to be out there as much as they can, because we can't play year round, so our time is kind of limited per year. But I think you need to be smart and listen to your body, because a lot of times pain is your body's way of telling you that something's wrong. And so trying to push through pain is not really the best idea. If you're getting through a round of golf with 2 or 3 out of 10 pain, that's probably something that you can just manage with a little bit of stretching before, a little bit of warm up, maybe a couple ibuprofen, anti-inflammatories, to kind of help with that. But if we're talking that you rely on medication, you rely on ice and heat to make it through one round of golf, then I think it's time to go get it medically looked at.
You almost got into my next question. A lot of people say, "Can you get me through the golf season?" And that's exactly what we do. You would maintain your pain. I'm sure you've been to the places where they have the 1 through 10. If it's at a 2 or 3, it's probably safe. Mm-hmm. Sometimes it's after a warm up, it feels good, which is exactly what we want to do before. Yeah. You may wear the elbow brace and keep an eye on things, letting them know that you can get it through, but if you continue with this, eventually you'll break down and you'll shut your golf game down longer. So you went in right into the next question, because I get those questions, I'm sure you do all the time. "Joe, can you get me through the season?" Yes, I can, but, and here's the things, these are the red flags that you always hear about. You can't even move the next day, you can't lift anything the next day. Those are things you want to kind of keep an eye on. And you also said another thing, golfers don't like to be told, "What can I do less of?" How does something like a simulated golf help the golfer in the off season in this area? Like a lot of people will do the golf travel, but in Chicago area, your golf season, what would you say, March to maybe November? Yeah. Pushing it December sometimes. Yeah,
hard.
The orange ball hard course.
Yeah, it's part of it is like any other activity. Sometimes a rest is needed. So don't feel like you have to be swinging a lot all year round. You can, and it can be helpful. I think that dosing is really an important thing, and usually one of the things I'll talk to about with my golf fanatics, my golf nuts, is this idea of maybe trying to focus on the off season where you're not outside playing golf, and focusing on more of swing technique and focusing on fitness and conditioning, and trying to get some of those joints that aren't moving as well a little more mobile, getting those tight muscles a little more flexible, building strength and stability where needed, so that you can have a more efficient golf swing, so that you don't break down. And kind of going back to our last question, what we were talking about, is some of the danger in going back to golf or playing through pain. Yes, it can further exacerbate the pain you're already having, but one of the other things that our body's so good at doing is compensating. And so when you have back pain and you're trying to avoid that back pain, one of the things that you might be doing is compensating how you're swinging, and now you're causing breakdown in other tissues, and it's like, oh great, I started with back pain, but now my hip is hurting. So that's one of the issues as well. So you don't necessarily need to feel like you have to play golf year round, although you can. But especially if you're dealing with injury, you may want to shift your focus more from playing to more of conditioning, or getting an instructor in the off season to maybe learn some better swing habits. I think that's kind of a good route. But playing on a simulator like we have here, going into a store where they have like a TrackMan or some sort of launch monitor type thing, I think you need to keep up the golf swing to keep with your feels and all that throughout the season as well. And I love swinging in the off season just as much as the next person. Whether it's playing around a golf on a simulator, whether it's just having a launch monitor to have access to, I think those are all good as well. But if you're dealing with pain, I'd maybe shift the focus a little bit to more of a conditioning from a fitness side, or looking at more of an instruction where you can really kind of hone your swing and make it a little less taxing on your body.
And that brings up a couple other things. I think you described, once again, my next question, Joe has always had it occur with me here, is golf is like any other sport. You have to build up again. Off time is important physically as it is mentally, shutting it down. And then as you start back, you would have the golf simulator you're in a controlled environment. It's not real cold. It's not going to be icy. You can still play, and then you can kind of look at certain things. A lot of times, the simulators would also may have a pro involved and say, here's what you're doing incorrectly. This could be causing this. When you start talking about the 360, what does that exactly do different than a simulator?
So we have a 3D motion capture software that's called K-Vest. And the simulators are great because it's going to show you some different club head kind of data and ball data, but it doesn't tell you anything about what your body's doing. It's just telling you what your golf ball is doing and what the club is doing at impact. So with something like a three-dimensional software like K-Vest, we're actually strapping some sensors to you, and it's essentially digitizing how you're swinging based on those sensors. And those sensors are telling you the position of where your body's at in space, and it's also telling you acceleration. So we're able to look at the sequencing of the body when you start using your hips versus when you start using your upper body versus when you start using your hands. And we know based on a lot of data from very high-level players and professionals that the body should move in an optimal kinematic sequence. And when we put an amateur golfer on there, someone who's struggling to break 100 or struggling to break 90, we put them on there and we're able to see now how they're sequencing their body. It gives us good objective data on how they choose to move. And sometimes that can tell you if there's some risk for injury, but also performance factors as well. And so, from the simulator side to having 3D software here, we're able to kind of hit all aspects. You can come in here and play around in golf just to keep up with your swing. You can do swing evaluation services that I do here, put you on K-Vest and do some 3D analysis, and really kind of hit it from all aspects. And then I do fitness as well.
Which brings me to something very current. You kind of mentioned now the science behind golf, which you've seen in every sport. And what was one of the things the most recent U.S. Open champ said is he used science a lot. And he obviously had some success. They keep saying he would never win a big tournament. I think the U.S. Open is one of the bigger tournaments you can win. What did he exactly say that's different now than, I remember Tiger Woods was really the first pro to really hit the weights hard and got bigger and stronger. I think if you look at Tiger Woods compared to Craig Stadler, a good golfer but a different body type.
Yep.
You look at how Tiger kind of changed that mode to strength training is important. How do you think this will change golf now?
Yeah, it's really funny when you can see John Daly and Tiger Woods walking down like a same fairway.
Cigarette in his hand.
Very different body types, very different lifestyles, but they both make millions of dollars. Obviously, Tiger a lot more millions than John Daly, but regardless, John Daly in the top, 0.01% of the best golfers, being a professional and winning, multiple times on the professional golf tour. And now you have Bryson DeChambeau, who is kind of bringing the really high end of the science stuff to the forefront, and everything is a science experiment. Everything he's trying to push, the realm of science into the golf swing as much as he can to give himself the biggest advantage. Now, all these guys on tour now have, their fitness guys, their medical guys, their swing guys, their sports psychology guys. And I think that although they don't maybe talk about it as much, you might hear them say, I saw the physio or I saw my trainer. You look at guys like Dustin Johnson and Brooks Koepka. I mean, fitness has now been around for the better part of 10 to 15 years, with things like Titleist Performance Institute. They're really doing a good job of bringing fitness and conditioning to golf and making golfers, better athletes and not just golfers. And so now you have Bryson, who is what we've found with the modern game and with what technology is doing, hitting the ball a long way gives you a significant improvement in scoring. And so you look at something like Winged Foot at the U.S. Open, a course where they didn't think anyone was going to be under par because the rough was so thick, the greens are so intense with the slopes. And now you have someone like Bryson who's coming in and hitting.
Challenge it.
Yeah, and he hit, he hit the least amount of fairways as any U.S. Open champion has ever hit. And so it's not all about hitting fairways anymore. He bludgeoned the golf course. As the architect Gil Hance, who redesigned that golf course, said, he bludgeoned the golf course. He was hitting almost the same amount of fairways as most other people. He was kind of in the middle of the pack as far as fairways hit, but he's 40 yards ahead of everybody. And so when you're coming in with a wedge from the rough versus a 7-iron from the rough or an 8-iron from the rough, that's going to be a huge advantage, if you're missing a couple more fairways than the next person. And so based on him looking at club head speed and bulking up in the gym, gaining all this muscle mass, it's kind of, you can kind of laugh at it, but now he has the proof to show that what he's doing is pretty helpful.
And people always follow success. So I'm sure in the next couple months you'll keep saying, what can I do? I'm sure there'll be lots of articles. He's in the golf, he's in the golf hierarchy. He won a major tournament at a fairly young age, and did something different. Like you said, he basically dared the course to beat him, and it didn't. And I'm sure people are going to start saying, hey, if he can do it, I can do it also. So, it was amazing how it came out, and I've read some stuff. I'm trying to read more stuff, what he did exactly scientifically, but he also has something that not a lot of people have done. In fact, I think 3. He won U.S. Amateur, U.S. Open, and NCAA. And the other 2 golfers, you've heard of them, Tiger Woods and Jack Nicklaus, 2 pretty successful golfers that, not that he's in that category yet, but I'm sure people are going to be wondering, what is he doing differently? Because he's ahead of you. If you say he's 40 yards ahead, that's a big jump.
Yeah. And Bryson is kind of the far extreme when we talk about the fitness and the science of the game. The question is going to be, for what he did with his body in such a short period of time, from my medical opinion, my concern is going to be sustainability.
Yeah.
Because it's that extreme. But then you kind of go back and look down at some of the other athlete golfers who are in really good shape. They're going to have a very sustainable golf. Look at Phil. Phil's in, he's been playing for a really long time, and he's lost a lot of weight. He's obviously fluctuated a lot, but Phil has a very long career, and he's still competing at 50 years old. But Dustin Johnson has a very athletic movement. Brooks Koepka has a very athletic movement. Granted, these guys
Tiger Woods had multiple back injuries, and his game has never been the same.
Right, and so you have to kind of walk the fine line of what's going to be excessive amounts of load and these military type workouts versus what's more good for just explosive speed and power training for the game of golf, and being able to create speed with less toll on the body, because essentially the more capacity you have to move quickly, the less strain it is on those tissues, because you have that capacity. If I try and swing it at 120 miles an hour, and then somebody else who's much stronger, much faster, has a lot better conditioning program than I do, if they try and swing it at 120 miles an hour, they're going to do better because they have that capacity to do so. The question is going to be, you have to do it smart. You have to do it with good supervision and good direction from somebody who knows what they're talking about. So finding a really good strength and conditioning coach or therapist, some fitness expert that knows how to dose these things appropriately. Because done in the wrong way can cause tissue breakdown, can be detrimental to the body. So you have to do it smart.
So getting back to what we want to kind of do, what are a couple things, stretches, things that an amateur golfer can do to prepare to help avoid some injuries? As much as Joe would like to see if he can avoid it, he's a golfer first, and he wants to try to avoid it, and I'm sure there's some things you do. What are a couple examples of some stretches you'd like to show?
Yeah. So let's go to lower back pain, because that's going to be the thing that most golfers are going to experience at some point in their golfing career. You're going to complain of, my back is sore after my round, or the next day you wake up and my back is tight. That right side of my back is just stiff today. That turns into, at the end of the round, my back's bothering me. It's the 16th, 17th hole. I'm kind of limping into the clubhouse. And then that's going to turn into, I get through the 4th or 5th hole and my back's already killing me. And now you're that person who's taking pills to try and get through a round of golf. So when we talk about the lower back in the golf swing, part of it is looking at your swing mechanics and looking at how you swing the club. You have to have your swing analyzed, because there's some very big things that you might be doing wrong just from your golf swing that's putting a lot of toll on your spine. Golf is a rotational movement, and it's a lateral side-to-side movement. When we go through life and when we go through daily function, we go through life in a forward and backward fashion. And so now you're implementing a high velocity, high speed activity in directions that we don't do throughout the day. And so when we look at the golf swing and how the body needs to work, it's really, as simply put, it's an alternating mobility and stability kind of mechanic. So when you start down at the ankle, your ankles have to have good mobility to them, and then your knee has to be very stable, and your hips have to be very mobile. Your lower back has to be very stable. Your mid and upper back has to be very mobile. Your neck has to be pretty stable. Your shoulders have to be mobile. So when we look at that alternating sequence, it makes conditioning and training very simple. If your knee needs to be stable, you need to have good strength around your knee. If your lower back needs to be stable, you need to have very good strength around your core and your hips. If your hips need to be mobile, you have to have good hip mobility. Okay? So when we look at exercises and a couple of good stretches that you can do to kind of warm up before a round of golf, or things that you need to just kind of stay, we get stiffer as we age.
Sure.
Right? You're not as limber as you used to be when you were 25.
Yeah.
Our spines degenerate, as we age. Over the age of 40, over the age of 45, most people are going to have some level of degeneration or some level of a disc herniation in their back, even if it's asymptomatic. So you need to be able to maintain mobility, maintain flexibility, and maintain strength in a culture that has us sitting for
sitting
a lot
in
of
a
the
car,
day.
leaning forward on our our desktop,
Right.
Doing stuff socially. And I heard physicians say lately, I'm getting more neck pain because we're all doing this now. We're all looking down at our phones. So
Right.
I think it makes sense that you're doing throughout the day, which is causing issues, and then you're trying to go out and golf, which will create another issue.
Yeah.
But I'm sure there's some things we can go over right now.
Yeah, so we'll talk about a couple of things you can do from a daily basis to maybe before you go to the golf course to kind of limber up and just kind of stay mobile. You can't really get stronger, from now going to the golf course. So that's something that we see over the course of time. If you can get stronger in 5 minutes, we'd all have six packs and we'd all look like, bodybuilders.
John Daly.
Well, that's the problem we're headed towards. We're all looking like John Daly to an extent. But mobility and flexibility and kind of prepping the body for moving for the golf swing is going to be really important. Here's a couple things we can do. Hamstring flexibility is going to be a big one. You don't want to go into a golf swing with tight hamstrings. Hamstrings are the muscles on the back of your thigh. Okay, 4 muscles that run up from the back of your knee up to the upper part just under the butt. So if we look at a couple good active hamstring stretches where we want to just take the hamstring through a lengthened position. If I have Tony hold the back of his thigh and he just lifts the leg up in the air towards the ceiling until he gets a good stretch behind the thigh, come back down, okay, and you do that 10 to 20 times on each leg, we're taking the hamstring in a lengthened position there, and as he drops the leg down, we're shortening the hamstring. So we're actively taking the hamstring through good flexibility and good range of motion. Active stretching is always good to do before you play. Okay, so you're going to want to do an active hamstring stretch. If you don't have the ability to pop on a table or something in a locker room at the course, you just sit on the edge of your cart. You put your leg out straight in front of you. Hard to demonstrate here, but you sit on the cart, you put your leg out, and you can kind of reach down towards your leg, and kind of go into the stretch and out of the stretch. Okay. This is different than bouncing into a hamstring stretch that you might see a lot of people doing where they bend down and they're staying in a stretch position and kind of just, kind of bouncing in and out and in and out and in and out. That's more ballistic stretching. We don't want to do that. You want to do more active stretching where you're stretching all the way into it, coming all the way back out of it. Into it and out of it, and trying to get a good active hamstring stretch that way.
And if you start feeling some tightness during a round, stop and do this.
Yeah.
Joe and I have talked about this. It's not like it's locked into that first hole or before you start out. All these stretches can be done. You may stop for lunch for 5 minutes or 10 minutes and get back on, or you may be in a group where it's a slow foursome ahead of you. Take advantage of that time to use it productively.
Yeah. So another thing we want to look at is maintaining mobility in our upper back, or what we call the thoracic spine. Okay, so I'm going to have Tony lay on his side. Go ahead and you face me, lay on your side there up on the table. And you can turn this way. What you're going to do is hike your knees up towards your chest. Your top hand is going to reach in front of you, and you're just going to rainbow up and over and get a good twist out of that upper back. We call these open books or story books. Okay, and this is just a really good stretch to help rotate the upper part of your spine, which is where all of our turn comes from in the backswing. We need to get good rotation in our upper body and good rotation in our hips. So this is a great stretch to do because most of us get really tight and limited in our range of motion in our upper backs to help open up that upper spine. If you don't have access, if you want to do this mid-round like Tony was talking about, just grab any club in your bag, put it behind your back, get your feet nice and wide into a little squat position, and then just work on side-to-side rotations, keeping that golf club nice and level. You don't want to twist the golf club this way. We don't want to see any side bending from your lower back. Just a level golf club and rotating side to side this way, and just keep that upper back nice and loose. Okay.
Joe also mentioned rotator cuff, which you'll see sometimes in golf, and I use this with also baseball and softball, and Joe can demonstrate the real easy stretch to come back here where your hand's just behind your back, your club's back here, and you see people do this sometime, and Joe's just stretching and bringing his hand up and down. That's going to stretch it, and he can always do this both sides. Okay, he's also opening up his chest in this little also. So that's helpful. And like I said, you better have clubs on the course, and you can do it pretty easily. And like I'll keep reinforcing it, it helps to do this several times also. Between shots, especially when you get into some of these cooler fall days, you want to prevent injuries. You don't want to cause them.
Yeah, so you can do some good external rotation of the shoulders here, keeping that elbow tucked to your side. And here you can wrap the club here and kind of rotate it back to get a good external rotation and stretch that way. So use the club to your advantage. You can do a couple stretches while you're on the course because like Tony said, if you're playing a public course, it's taking 5 hours to play around a golf, you're going to be waiting a lot. So try not to stiffen up during the rounds and make sure you kind of stay limber. Stretch the hamstrings, stretch the upper back, keep the shoulders mobile. And if you need to, pop your driver out in front of you and just do a couple little squats, just kind of down and up. Just keep all the leg muscles engaged and keep those, muscles working too so that you can, stay swinging with a good, good velocity with good speed by keeping all those muscles engaged.
Getting back to sitting in the cart, another real easy one to do. Joe mentioned how hip flexibility and mobility is very important. A real easy one, we just kind of call this the 4 stretch. As you come across, sitting nice and straight, pushing that knee down very slowly, hold for like a 5 count, and release. That'll keep that hip real loose. And it's important to do that. You can also do that from a standing position. So Joe may be near towards his cart here. He would just bring his foot up on the golf cart there and just kind of stretch out that area. And he gets that knee bend and he keeping his shoulders and everything back. So it's a real easy thing to do. It doesn't take a lot of time and it's preventing injuries. You want to golf more. And I think that's what we're trying to show with this presentation.
Yeah, so, in terms of, ailments, injuries, things you might be going through, all of our Athleticos have free assessments. You can have any of our physical therapists take a look at you, complimentary to you, where we identify, what might be the problem, refer you to a physician if we feel that's necessary, recommend starting therapy. We have direct access in the state of Illinois, so you're able to go to physical therapy without a doctor's prescription. But if we find there's something that might need medical attention or imaging or any other testing, we would refer you out and recommend a good physician for you to see. At our Oak Brook facility, it's our only golf performance center, so we do biomechanical swing evaluations here. We do the K-Vest 3D analysis that we were talking about earlier. We have our golf simulator that's open to the public as well. You don't need to be a patient to come in and use the simulator. You can use the driving range. You can play 18 holes, 9 holes. We have a great winter golf league that we're on. We're going to be on our 4th season of doing that, and that's really popular. So you can sign up for that and still play through the winter. And other than that, any questions, I'm always happy to help the golfers in the Chicagoland area. I love golf. It's my passion, and physical therapy is my passion. So, adding those two together is kind of a win-win. So I'm happy to answer any questions that you might have. My contact info where you can reach me. My email is the best way to contact me, and that's Joseph, that's Joseph .estes, E-S-T-E-S, @athletico.com. And you can shoot me an email, and if I need to point you in the right direction, I can. But that's pretty much, I think, sums up what we want to talk about.
Excuse me, the real key is preventative. If you feel something coming on early, that's where it's important to get evaluated quickly. That's where the free assessment comes in. I'm like that in the athletic training room. You see something, you get it early, and a lot of times you take care of it. If you let it linger, that's where some of the issues come on. So take advantage of that. And we really are happy you took some time out of your schedule to let us speak to you. Any questions, you can get back to us. Both our emails will be presented on this also. Thank you very much, and let's golf and stay healthy.
Thanks, guys.